Have you ever considered how healthcare professionals navigate life and death decisions when a treatment that relieves suffering might also shorten life, or how they ethically justify such choices? Scholars often criticize the principle of double effect in palliative care, primarily due to the complexities of defining and proving intent. The argument that foreseen harm can be morally equivalent to intended harm, and concerns about its potential to obscure moral responsibility. These criticisms stem from several deep ethical debates. One major challenge is the inherent difficulty in precisely discerning a physician's intent, as it is a subjective mental state, particularly when multiple outcomes are anticipated. Critics also raise what is sometimes called the equivalence thesis, arguing that if a negative outcome, such as shortening a patient's life, is clearly foreseen and unavoidable, it becomes morally indistinguishable from intending that outcome, even if the primary goal was pain relief. Furthermore, some scholars worry that relying too heavily on the principle might inadvertently allow practitioners to justify actions that are otherwise questionable, reducing careful ethical scrutiny. To address these critiques, healthcare professionals and ethicists are encouraged to prioritize transparent decision-making, thoroughly document the rationale behind treatment choices, and engage in open communication with patients and their families. This often involves ensuring that the dosage of pain medication is truly aimed at symptom control and not at intentionally accelerating death, and that every effort is made to find alternative pain management strategies when possible. The process emphasizes a robust ethical review, focusing on whether the potential negative effect is truly an unintended, though foreseen, side effect of achieving a good outcome. Understanding these scholarly criticisms provides crucial insight into the nuances of ethical reasoning in medicine. It highlights that bioethics is not just about applying rules, but also about rigorously examining the rules themselves. For instance, the concept of moral slippage warns against a gradual erosion of ethical standards if the principle is not applied with extreme care, prompting a deeper focus on patient-centered care and the continuous reevaluation of treatment goals. This ongoing dialogue ensures that ethical principles remain robust and truly serve the best interests of patients. Ultimately, examining the critiques of double effect encourages a more rigorous and nuanced approach to end-of-life care, moving beyond simplistic justifications to foster greater accountability and ethical clarity. It pushes practitioners to engage in thoughtful reflection, ensuring that every medical decision is grounded in a deep commitment to patient well-being and a clear understanding of its moral implications, strengthening trust and upholding the highest standards of care.